The African Union is asking its member states to strengthen their health systems in order to manage the spread of infectious diseases in an environment that's soon expected to be borderless. 55 African countries are preparing to remove border formalities by 2020 as part of the African Continental Free Trade Area. CGTN's Coletta Wanjohi reports.
These are health and economic officials from different African agencies discussing how to restrict the spread of diseases when African countries open up for more intra-Africa trade next year.
For example, Ethiopian Airlines last year transported 11 million people through Addis Ababa. And other airlines are doing the same on the continent. Isn't that a good thing? It's a wonderful thing there. But again, with that comes the risk that we have to protect that industry as well, because all it requires is one serious outbreak and the airline will not be able to do that anymore, and Africa will come to a standstill. So the key message here is let's strengthen our public health systems.
The spread of diseases around Africa has led to epidemics in the past. Between 2014 and 2016, the Ebola virus spread from Guinea across land borders to Sierra Leone and Liberia. The World Health Organization called it the most complex spread of the virus since 1970. Currently, the Democratic Republic of Congo is struggling to contain the Ebola virus, which has so far claimed the lives of over 2,000 people in just over a year. The African Union says the single market that it is targeting will be worth over $3 trillion. Health experts say that needs to be balanced against the risk of spreading diseases.
The threats are there, and we need to be able to build our systems to not only detect, but to be able to respond promptly and effectively. And we also need to be able to ensure that our health systems are resilient and they are able to cope with whatever comes our way.
The UN Economic Commission for Africa says African governments are not likely to increase their spending on health systems under the African Continental Free Trade Area, the CFTA. Only 3 have so far honored a requirement set by the African Union of spending 15% of their budget on health, leaving a gap of $66 billion. It advises that the continent looks to its private sector.
The key theme is how do we leverage on the AfCFTA to create the capacity for our economies by, first of all, through fiscal space, strengthening our manufacturing of pharmaceuticals, and the movement of medicines, movement of medical supplies across countries to be able to deal with any challenge in the health sector.
But the UN says private investors in Africa will need a lot of convincing because they are not keen to put their money in the health sector. Its statistics show less than 2% of drugs consumed in Africa are produced on the continent, meaning $14.7 billion worth of drugs are imported every year. Coletta, Wanjohi, CGTN, Addis Ababa, Ethiopia.